Hi, this is Dr. Tina Welsum, and I am not a medical doctor. I'm a doctor of physical therapy, but I do teach cardiopulmonary physical therapy, and I have worked with many cardiac and pulmonary patients throughout my 20-something odd year career. I live in the New York City area, and as most of you know, and you're tracking the COVID virus, it's hit our area pretty hard. And people, friends, loved ones, people who know loved ones, are passing away from coronavirus and are fighting coronavirus in their homes right now that I personally know. So a friend shared with me a video tonight that a prominent reporter posted from his basement, and I think that it had a really good message that I wanted to make sure that I conveyed and shared, and I'll post the link to the video as well. So we don't know a whole lot about COVID and the coronavirus, right? We're dealing with it, we're fighting it, but what we do know about the lungs and the immune system is that our lungs function better when we're in an upright position. So when we are upright, we inhale and the air that we breathe goes down into the bases or the bottoms of our lungs, and that's where the blood supply is best. So we have the best ventilation, air, perfusion, blood flow ratio when we're in an upright position. Upright can be sitting, it can be propped up in bed, it can be standing, it can be up and walking and moving about. When we feel sick and we don't feel good, we take to our beds or we're hospitalized, right? When we are lying down in bed, the airflow and the blood supply are not in as good of a match. And so we don't have the best ventilation perfusion ratio. So we know that coronavirus affects our lungs, and we know that it makes it hard to breathe. And so when it's hard to do something, we as humans, if it hurts or it's painful or it's hard, we don't want to do it, right? But if you're sick and you're fighting coronavirus, you do want to fight this. You do want to get better. You want to do that for yourself, and you want to do it for your family. So taking nice deep breaths, if you can, is very important. It helps get fresh air in, it helps get the stale air out, and the other infections, bacterial infections, the secretions that build up in your lungs, it helps get that out, and that's very important. You want to make sure that you're staying hydrated, and not, at this point, we're not just talking about pure water, but also things like Gatorade that have electrolytes or broth that has protein in it, so that you're keeping yourself hydrated and you're giving your body the nutrients it needs to fight this virus. Fever is let me go back to the hydration. When you stay hydrated, not only does it make sure that your whole body doesn't get dehydrated and your blood pressure drops and things like that, but it also makes sure that any secretions that you have in your lungs stay thin, and it makes it easier to cough and get them out, and that's important. You want to do that. Let me go back to fever. So fever is our body's first line of defense against fighting an infection. Our body turns up the furnace, and it's to burn that shit out. Excuse my language, I'm gonna swear. It's to burn that stuff out. So whether it's a bacterial infection or in this case a virus, our body turns up the temperature to try to burn it out. So if your fever is, they usually say 103 and below, and you can be comfortable, you aren't hallucinating, you're not having seizures, you can eat, whatever, go ahead and let that fever rage and let it burn the stuff out. Stay hydrated for anything that, all those fluids that are burning up. But if you're in intolerable pain, if that fever is getting high, if you're having hallucinations, things like that, then you want to take Tylenol. And Tylenol is an antipyretic. It will lower your fever, and it will also lower your pain, but it's not an anti-inflammatory. Experts are advising not to choose things like Advil, Motrin, Aleve, naproxen sodium, all that stuff right now. So Tylenol is your best bet. So yes, you want to rest, but you don't want to take yourself to bed and put yourself there. You want to do active rest, and that's something that as physical therapists we've advocated for years for almost every injury and illness, and studies after study after study show that that's most important. So yes, you don't feel good, you don't want to get up, you don't want to move around, but light exercise, going for a 5-minute slow walk, getting out in the sunshine, getting fresh air, getting some vitamin D, getting that exercise actually will boost your immune response, and it will help your body mobilize the cells that it needs to fight this virus and to help you get better. So if you're at home and you're fighting coronavirus, my heart and my prayers go out to you. Hydrate, active rest, nice deep breaths, and fight it with your heart. If you're into spiritual things like yoga, your heart chakra, that's where your lungs and your heart are. But I know that anybody who's out there doesn't want to be sick with this, and they don't want to lose the fight to this because they probably have loved ones and family members that they want to stay there with. So stay strong in your heart, fight this, and know that my prayers and my love is going out to you. Be well. Bye.